Hi, everyone. Thanks so much for joining us today for our Wasatch Crest webinar. Today, we are going to be talking about the opioid overdose crisis, and we have a couple members from our executive team and then our clinical team to give the presentation. Our executive director, Rich McDonald, is here, and so is our primary therapist, Kevin Kirschenmann. I think that's all I have for you. If you have any questions throughout the webinar, feel free to ask them using your control panel. And then we also have a Wasatch Crest handout included in the control panel, so you can download the packet and learn more about us. That's all I have, but I'll let Rich and Kevin kick it off.
Excellent. Hey, thanks, Kayla. My name is Rich McDonald. I'm the executive director of Wasatch Crest up in Heber here. And I appreciate everybody joining us this morning. This is a kind of sobering topic, but it's one worth talking about.
And hi, my name is Kevin Kirschenmann. I'm the primary therapist here at Wasatch Crest Treatment as well. We are very excited to be here and talk about this. Is a very serious subject. In fact, it's a subject that's very serious in terms of regionally where we're at, not just in Utah, but in the United States. So we in America have about 4.5% of the entire world population. Yet we use in America 30%. We're 30% of the opioid use in the entire world, and there's lots of reasons for that they look at, or possible reasons, including in Europe. There's a healthcare system that supports that does things a little bit different than we do. They primarily administer like opioids in the hospitals and nursing homes. We tend to bring them home and have them have people take them home. We also have less healthcare access, as I said, so that sort of contributes to that idea. We have a culture of fix it here. In fact, we are there was only 2 countries in the world that I'm aware of that will allow prescription medication itself to be advertised on television. And so we and New Zealand are the 2 of them. We know that Canada for years has had a problem with prescription with opioid abuse.
That's one of the, I'll just add, if I've been telling everybody I know to get on Hulu and watch this new kind of limited television series called Dope Sick. It does an incredible job of exposing and explaining just how pervasive the pharmaceutical industry became in the opioid crisis. It's also a great way it did an incredible job of showing kind of drug addiction and how it can take hold, and the kind of people that it can take hold of, and just the overall example, or the way that they showed the day-to-day life of somebody who's addicted to opiates was incredible. And it's a heart-wrenching show, but totally worth watching, and everybody needs to know the story.
Yeah. So there's quite a bit of statistics we want to just kind of start out with to give it kind of a baseline of what's been happening. We're looking at an epidemic, and I'm getting numbers from the CDC, who is talking about the number of drug overdose deaths that they've increased by nearly 5% from 2018 to 2019, and it's quadrupled since 1999. So the overall rates, and over 70% of the 70,630 deaths in 2019 involved in opioid of some sort. From 2018 to 2019, there were significant changes in opioid-involved death rates. So they have increased. It's a little bit more complicated at times because the government did kind of try to come in, do some regulations, I think in 2016, which gave some guidelines for prescribing physicians in terms of the synthetic ones that are prescribed. Unfortunately, it did decrease some of the death rates in terms of the opioid, but with illicit drug use like heroin and fentanyl, things like that, that actually increased. Some of the ideas of that, I don't know if this is true or not, or bears out, but with the guidelines, they were talking about people that would be first-time opioid users had chronic pain. This was outside of chronic pain with cancer or death, or near death, like with hospice. But with doing that, they lowered these rates that they would allow in those people that were on higher rates or that were drug abusers. And now we're going to doctors. We're having much lower rates. And so we see an increase of deaths because of illicit drug use, because now they've been thrown into extreme withdrawals.
Absolutely.
So,
no, and I think you touched on the fentanyl piece. So one of the problems that unless you're totally disconnected from any sort of news or social media or what's going on in the world over the last, many years, we've heard people talk about fentanyl. And one of the problems with fentanyl is that the amount of fentanyl you need to overdose is so incredibly small. That drug is so incredibly powerful. I think it's 100 times more powerful than morphine. And it's also created in a lab. So you don't need the opium poppy to make fentanyl. It's something we think a lot of it's coming from pharmaceutical labs in China. It's very easy to send in the US postal mail. It's something that is really quite frightening, and it'll be some of the most recent overdose deaths that I've spoken with family members or loved ones or people that I am some way connected to. In every situation, when they get the toxicology screen back, there's been fentanyl involved. It's super frightening. Kevin touched on statistics nationally, and we're going to talk a little bit about, how we can, beyond addiction treatment, also keep our loved ones or the people around us safe with naloxone. And there's an excellent website. It's the Utah Naloxone Project. And it was started by a physician named Jenny Plum, who lost her older brother many years ago to a heroin overdose. On their website, I'll just share some of the Utah statistics and then tell you a little bit about naloxone and what a difference that has made. So as of right now, the most recent statistics in Utah show that drug poisoning deaths are a preventable public health problem. And although it is preventable, they are the leading cause of injury and death in Utah. It outpaces deaths due to firearms, falls, and motor vehicle crashes. 10 Utah adults die each week from a drug overdose. Utah specifically is affected by the prescription opioids. It's responsible for 41% of the unintentional overdose or drug poisoning deaths. And then this is one that kind of blew me away. 1 American dies every 5 minutes from an overdose. In 2021, the most recent data that was just published, in a 12-month period, 100,000 Americans died of overdose. We had the 4th highest rate in Utah of drug overdose deaths in the US. In 2014, we were the 7th highest. 2013 to 2015, 21st. In 2014 to 16, we were the 22nd. And most recently, we are the 38th. So it has been getting better. And I think, my personal belief is that that's a result of some of the initiatives, public initiatives, and nonprofit organizations and education organizations, and some of the ways that they've stepped in to educate and make access to overdose or opioid overdose reversal drugs possible and accessible. So Utah Naloxone started a project. If you live in Utah, you'll see billboards all over the place. And they'll have, most of the time, somebody who's passed away from an overdose and share the information. But until recently, you could not buy naloxone, which is an unabusable prescription drug that blocks the opioid. It actually pushes the opioid off the opioid receptor and makes it, reverses the overdose. You could not buy it without a doctor's prescription. And recently, I want to say it's probably been about 5 years, they made it possible for anybody to walk into any pharmacy and buy naloxone. It is something that I have in the glove box of my car. I've got some in the glove box of my wife's car. I've got, I keep it handy. We keep it here at Wasatch Crest. And essentially, if you believe somebody's having, is overdosing from opioids, they make a nasal spray or a injectable. And once given, it kicks the opioid off the receptors and revives people very quickly. They also did something that I was not aware of that made it more likely for people to call emergency responders. In the past, if a emergency medical responded to an overdose, they were required to transport them to the hospital. And what they realized was fear over being arrested or criminal charges or the consequences of calling the professionals, people wouldn't call. And so Utah changed the laws around that, and now emergency responders encourage the victims of the overdose to be transferred to the hospital. But if they do not want to, they can sign a release and emergency medical can leave them there, which is, I think, a really big deal. Regardless of in the past, if they would have charged somebody that had overdosed, that was a fear that many people had.
Well, I understand there's about a 75% increase in first responders having that with them. And with you, Rich, I've noticed when I'm at the pharmacies now that I see that actual sign out there that says you can get this here, which is really awesome because I too have mine in my glove compartment. I'm starting to think, I had a conversation last night with my wife who has a son that now has some back surgery and he has infection in his muscles near his spine. And she just wept and got so sad about the possibility that he could become addicted and then die from that. And she was more upset about that than death itself. She thought, well, him becoming an addict and becoming addicted. And I thought to myself, well, I need to have these more readily accessible to myself.
Absolutely.
Whoever you're around. I've not had that experience yet, having to administer it.
Right.
But it would be an easy way to have the reversal drug on anyone and probably prevent many deaths.
Yeah. No, absolutely. And it's one of the things that, honestly, the opioid pain relievers were, something that was super positive for humanity. It allowed us to treat pain and surgeries and but as with almost everything, there's always unintended consequences. One of the stories that is shared on the Utah Naloxone website is the founder, Jenny Plum, had come up to a stoplight and there was several people crowded around a car, and one of the other drivers had gotten out of their car, got to the person that appeared to be passed out and administered the naloxone, and the person survived. So you never know.
Well, the wonderful thing about that is that it won't affect somebody that doesn't have it. It's not going to hurt them. It won't bind to anything. It will just stop those receptors, will block those receptors. So it's not going to have any unintentional harm, because that's what people are scared about. That if I did this,
absolutely,
that won't hurt someone if that's not what's happening.
No, absolutely. And it's the one thing I was going to mention also is in the state of Utah, you can call your local health department and they will provide it at no cost. So depending on where you're at, definitely check with your local health department, county health department, and many of those across the United States now provide naloxone at no cost, or they can at least point you in the direction of an organization that will provide it at no cost.
So do you know, Rich, if that's possible to walk into the pharmacy and just say, hey, I'd like to get one of these. Could you pay for one now? Do you need
you can pay for it at the pharmacy.
Do you know about what the costs are? Have you ever?
The nasal spray is a little more expensive, but it depends on the pharmacy. You can, somewhere around $30, you can get the injectable kind, maybe even less. I know that some government funding handles part of the charge in a lot of areas too. So it could be a lot less expensive than that.
But we are seeing a lot more of this in treatment, aren't we? I'm seeing people that are
Absolutely.
taking fentanyl that are coming up positive in the UAs for fentanyl. So it is really scary. And as you said, it's replacing gun violence and auto accidents. I think in some cities, it's actually the death rate is surpassing murders in some of the bigger cities where homicide was large. So this is truly an epidemic that needs to be dealt with somewhat of an easier solution. There's more complicated parts of that, like prescribing, that sort of thing with doctors and other things. But the amount, billions of dollars that are spent in treating substance use disorders and the opioid epidemic, we could use hopefully some of those dollars, and our politicians will allow some of that to go to things like this, education and reversal drugs and awareness. Because otherwise that money is going into the criminal justice systems, to treatment, to child, like DCFS and CPS and other organizations that are so affected by it.
Well, absolutely. And you know, one of the things that I think is important as well is to mention is it's not necessarily somebody that's a daily opioid user or suffering from addiction that's overdose. Sometimes it's accidental. People don't realize just how incredibly powerful some of these drugs are. And so if you've got somebody with chronic pain that takes opioids daily, or somebody has a major surgery, like having that naloxone available is a really good idea across the board. I know a friend who's a personal friend who's a pharmacist, and one of the things that he encourages the pharmacy techs to do is make sure people that are picking up those prescriptions know that it's available there at the pharmacy, which is super important. One of the things that we also wanted to kind of mention is what we're trying here at Wasatch Crest to do to support and keep clients safe, because we all know that when somebody comes to treatment, you know, our absolute goal is to help them become sober and live a happy and healthy life. But we also know that that may not always, their first treatment experience may not be the one that sticks. And so about 1.5 years ago, we started to educate our residential clients and let them know about the availability, how to use it. We've got it in clear boxes on the wall that anybody can access. If they were to wake up in the night and their roommate had, God forbid, overdosed, they know exactly where the naloxone is stored. And then at our sober living, our men and women sober living, we have in the common areas on each floor, we have availability of naloxone. But we also, part of their orientation when they transition to the sober living is they're trained on how to administer it. There's some short videos that have been produced from, one of them is from the health department, the other's from Utah Naloxone, on how to administer naloxone and what to do and when to do it. And I feel like, you know, especially in that outpatient setting, it's super important. And we also have it available if once somebody completes the program, they can take some home with them, which I think's been really good too. And our hope is they don't need it, but you know, the likelihood of them kind of rubbing shoulders with other people that are abusing opioids, maybe family members, you never know. So I think that's one of the things that we think is incredibly important, that education piece. So the overall message we want to leave everybody here today with is just the, you know, be aware, please get some naloxone, keep some at home. If you're going to put it in your car, it has to be a special kind or different version than you'd hang or put in your medicine cabinet, so that it doesn't deteriorate like the effectiveness if it's in your glove box in your vehicle. But you know, there is a solution, and it's not just about reversing drug overdoses, but it's also treatment. I think this is an important piece of it, but the bigger idea truly is to help people find their way back to that happy and healthy life. You know, we know that recovery can work. And this is just one of those pieces that I think we need to understand it as something that will help keep people alive until they're ready for treatment.
Yeah, we know that there's a correlation between the success of treatment, or people becoming sober and entering sobriety successfully, and the time that they are in treatment. So if we can extend that and allow someone to come back so that their odds can be much greaterly and much more enhanced to come back at some point, it might keep them alive long enough to, you know, at times to come back in. And I think the message we want to be able to share with others is to share it, is that we want that to be something now we can tell someone else, we can tell our family members, and it's going to be education, but there's still so much lack of knowledge. And
Absolutely.
so I guess that's one of our objectives today.
Absolutely. And we're all, you know, it's the public health crisis of my generation for sure. And, you know, maybe beyond, between this and COVID, which is a whole other realm that we are still seeing the after effects.
Well, we're still
for years.
And we're still seeing, and COVID's another one we're not talking about today, but COVID has also affected this. And it's not made things better, it's made things worse.
Yeah.
So,
and unfortunately last year, you know, the number of overdose deaths had stabilized somewhat for a couple of years, and it increased dramatically last year.
yeah.
So be aware of what's going on around you, be safe, and if you know somebody that needs treatment, you know, even if we are not the place, Wasatch Crest isn't the right fit, our admissions department is amazing, and they'll help you find the right fit somewhere.
Point you in the right direction.
Absolutely. So that's all. Any questions, Kayla?
Sorry, no questions that I'm seeing. So thank you, Rich and Kevin. That was awesome, insightful, and interesting. And for anyone who wants to learn more about Wasatch Crest, our website is wasatchcresttreatment.com. There's our admissions phone number. It's 24/7. You can also find that on our website. And thank you for joining us. Thanks, Rich and Kevin.
Thanks.
Thank you.
Have a great weekend.
Bye, guys.
Bye.